Good afternoon. We're going to be looking at different ways of proning. The reason that we're proning now, as proning's been out for a long time, to be fair, but not many patients were prone compared to when the pandemics come in. So with COVID, within somewhere like ITU, they're proning up to 16 hours a day. Lots of different types of techniques, and within manual handling we've tried to look at different ways we can do this to reduce pressure on the staff. There's lots of force in the hands, up in the neck and their shoulders where they're holding on to the patient's bed sheets to turn them. So we are going to be looking at different ways of doing this today, from patients manually being able to turn over themselves to a patient that needs a bit more of assistance to put equipment in using Posture Care's proning position. And we're also going to be looking at the worst case scenario, patient can't do anything for themselves, and how we can do that outside of ICU. In an ICU area, we would be using something called, as I said, the Cornish pasty, where you get up to 9 staff using the bed sheets and pillows to prone the patient completely onto a proning mattress, so you can deflate the head cells, keeping pressure off the face, stopping the pressure ulcers around the mouth. Or equally with an overhead hoisting system, where you're using repositioning sheets and pillows to allow the hoist to take the weight of the turn over into full prone. So at the minute, we're just going to look at asking James, who's it may not even have COVID, to be fair. You know, we talk about COVID and the problems with our chest, but it doesn't have to be COVID. It could be just a general chest infection, general flu. Actually, research actually shows that having the pressure off your lungs opens up those lungs. So laying down, when you're laying flat, you've got a lot more pressure on them. So we want them patient turned. So if anything else this COVID has brought, it's actually taught us a lot more about how we position our patients. So James, what I'm going to ask you to do is, could you turn over onto your stomach into the prone position, just to stop you coughing, because I keep hearing you coughing away there, to take that pressure off your chest. So this is a patient quite independent on one of our standard wards that I would ask to turn over to take that pressure off. So we've now started to open up his airways a little bit, his neck's stretched out, so his lungs are starting to open up. Now, how does that feel to you, James?
It's okay for now, but I could imagine it being, it's putting my back into a little bit of flexion, my lumbar spine, so I think it might be a little uncomfortable after a while.
And I totally agree with that. As someone who can't lay 5 minutes on a sunbed on my belly, I know that that would give me a problem, because the back is arched. So that's a lot of force, and as gravity plays its part, pressure is going to start to go into those weaker areas, which is going to be here, into the lower back. And I don't know whether you've seen, I know what I'm like. When I've laid in this position for a period of time, I get up and I start walking like I've got cramp. I'm physically unstuck and can't move. So we need to be popping cushions and pillows in to support that area and lift it. So we're going to be using Posture Care's proning positioning pads to try to lift that up. So again, this is an independent patient who can help us. So we're going to ask the patient if they can bend their knees up so we can put the hip pad in. So we want to make sure that we get that in line with the hip bone there. So it just takes those hips off. We now want to put the chest pads in. So you don't want those chest pads so high that the patient's head rests on them. It actually almost needs the head leaning over, going onto the head pillow itself. So you're resting the forehead down. So head forward, so that's it. So you want to initiate a gap between the head and the chin, so you enable that if the person is on BiPAP, which most of your patients would be on BiPAP if they're not on ITU, you've got this big tube with the BiPAP, I wouldn't say it's called a helmet, I don't know what it's called, the oxygen case that your head sits in. You want that tube to be able to hang without catching in any parts of your face. So it really, really is important that the head is down this way so this tubing is free. Now, we're finding that patients actually in this position can tolerate more than 10 or 15 minutes. And I'm sure if I was on a sunbed with the nice cushions like that, I could tolerate more than 10, 15 minutes. I might take it on holiday with me. Technique we're going to show you now. This is a patient who is not as easy to put the blocks into. So they need more of assistance. So we're using an air device to lift the patients, the GBUK's air device, and we're going to be putting the Versal in, so we can actually position the patient over onto the blocks using this equipment. You can see that we're putting a Versal slide sheet on top of the air device. Now this is a full air device from head to foot. As we slide the slide sheet down, you can see it actually goes in really, really easy, and then we're going to prone the patient over onto the air device. Now the problem we've got with the full length air device, you can only take it out so far, and therefore the rest of it remains in situ. Although they are quite breathable, I really wouldn't want to be leaving a patient on this device for up to 16 hours. So we will be looking at doing an alternative. Also see that we are pulling the pillow up to James's pelvic bone, and that's actually taking a little bit of force because we're using a full air device. Now although the air device lifts the patient up really, really well, we're having to struggle a little bit to get it into situ. Is we're going to be looking at putting the Levitex postural support in using the half mat. So we're going to put the slide sheets in first of all. We're then going to put the patient onto a half turn onto the half mat and then prone them, putting the postural supports in afterwards. As we pop the slide sheets in, you can see that we're folding them up into small folds all the way to the top and then unfolding all the way down. As you can see, once we get to the hips, the girls are stopping and they're moving it through the hip area one at a time. That way you don't put any force or any pressure on the hip, especially if they've got very porous skin. Once the slide sheets are fully in situ, we're then going to move the person to the edge of the bed, and then with a slide sheet turn, bring the patient over onto the half mat that we've put into position as we've put the person onto the edge of the bed. Once we've got them fully over, you can see how much easier it is with the half mat up when we put all the postural supports in. You haven't got that extra push and shove as we did with the full mat. Or the half mat, it only goes a quarter way up and it fits really easy. Once we've got this patient, we can deflate the mat itself, and it's easy to be removed because it's only halfway down the body, so we can actually bring it down and take it out, leaving the patient into position. It's really important that you put a slide sheet in underneath the half mat, because when you put the postural supports in, they slide into position a lot easier. You get an awful lot of force if you're just actually using it on the bed sheet. It's actually going to get caught. So popping a slide sheet in makes it easy to position those pads. The Cornish pasty technique is what's used in most ITUs. It's a really good and effective technique. You need at least between 6 and 8 staff to do this technique, and it is where you wrap the patient and all their leads and drains into the bed sheet with pillows on the chest and across the abdomen. You wrap them up so that the pillow sheets are tight around the body itself. You bring the patient with a slide sheet underneath the sheet. You bring the patient up onto their side, bring the patient towards you, and then over onto their front. Unwrap the sheet itself. It's a really, really good and effective technique, but as I said, you need at least 6 to 8 staff to do this. So we're going to move on to see if we can do the proning technique with less staff by using a hoist. This last technique, we're going to be using a hoist, a Versal slide sheet, a repositioning sheet, and 4 members of staff to prone the patient. We put the Versal at the top of the bed and clipped it to the headboard. This stops the Versal from moving. On top of that, we're then going to put the repositioning sheet. Unfolding the Versal underneath the repositioning sheet, underneath the patient itself, this repositioning sheet is breathable, so it can actually remain in situ. So we're going to pull the slide sheet down. Once we get the slide sheet down underneath the patient itself, we are then going to cocoon the patient as you would generally, as in the Cornish pasty technique, within the bed sheet, with pillows across their chest, abdomen, and their legs. That way we are protecting the patient as we start to roll the patient over, and we want the patient elevated as we would as if we were using the Cornish pasty technique. Slide the patient to the edge of the bed, connect the repositioning sheet to the hoist. Lower the bed to its lowest level and then start to bring the hoist up. That way you're going to get a nice bit of height. This is why ITUs should be designed with overhead hoists. If you've got overhead hoists, you wouldn't need to lower the bed. But in this case, because it's a mobile hoist, it's only got so much height. So therefore we drop the bed to its lowest point. This does mean the staff do need to bend down a little bit and look after their postures. So it really, really is important that ITUs need to be kitted in the future for this technique. Once we've got the patient over into the prone, we're actually going to reposition the pillows to make sure they're in the correct position, remove the slide sheets, unattach the hoist itself, remove the hoist away from the patient, and then cover the patient with a fresh bed sheet, ensuring that their head is turned and then they're not laying down on any tubes, and reconnecting any drains and drips.
Hello everybody, I hope you can hear me. Really looking forward to today, and you can see the amount of work that went into those proning, and the reason that we chose proning is because it's such a difficult subject at the minute with the amount of times these patients are being moved. So looking forward to answering any questions that you might have, and if we run out of time then we can go back afterwards into, I forget the name of the area we're going into, I'm sure Jade will remind me, so we can have a chat. So please do come and talk to me.
Okay, can everybody hear me?
Yes.
Excellent. So I will go with the first question that's been submitted by an anonymous person. Can you leave the hover mats in situ once you are finished?
Some of the suppliers, well, most suppliers will tell you that they've got a good breathable surface on them, so you might be able to leave it in. I personally wouldn't, and the reason for that is I do a lot of work with tissue viability, and my concerns are if the patient starts to sweat, you're going to start to increase that risk of pressure damage. So those were the reasons why we looked at two size hover mats or air pals. Was because we were looking at a full one and trying to get it out, and you could see we managed it, but it was quite difficult to try to remove it. And then when we went over to the half mat, we actually removed that quite well because it's actually only at the top part of the torso of the body.
Okay, excellent. And the next question, was it better with half mat or full mat?
The half mat was so much easier. Once we got the slide sheets in place and then positioned the half mat in, you could see by the video, it just sort of sat into place really, really easy. Now, when we pushed the patient up onto the postural supports, because we only had a half mat, we didn't actually put a lot of pressure on our postures. You could see throughout the whole video, our postures were not compromised at all. So a lot in proning, your postures are compromised. You're either, the bed's got to be low, or you're standing on tiptoe, or you're stretching over, or you're trying to hold something for a long period of time. So using those mats, we weren't actually doing that at all. So in answer to your question, I would recommend the half mat.
Excellent, thank you. And would you always use slide sheets, Sharon?
Yes, 100%. 100%. I think with anything that you do, if you've got anything that's immobile that you cannot move very well, whether it be a patient or an object, a slide sheet is the way forward. You know, it takes a lot of force off the person doing the technique, and it takes a lot of pressure off the patient when it's being removed, and then you reduce the amount of skin damage. So with everything that I do, I'd always recommend slide sheets.
Excellent, thank you. So if anybody else has some questions that they would like to answer, okay, we've got some coming up here. So the first one,
Catherine, there's three. I haven't moved them to published yet, but I was going to say there's three questions submitted. So I'm
excellent.
About revisiting the video, but if you want to ask the questions to Sharon and let her answer them, and I'll move them over to published if that's okay.
Okay, yeah, that's brilliant. Cool. I've got the first one here from Kim. Would the use of a turning bed be more helpful, especially at the moment?
Hi Kim, thank you for your question. Yes, I love turning beds. We have actually turning beds in our hospital, in our ITUs, and they've been a massive benefit, because if you've actually got some bed doing part of the turn for you, then you're halfway there. So I would recommend that. I haven't actually done the prone myself on a turning bed. That doesn't mean to say I'm not going to have a go at it. But yeah, I would recommend that.
Okay, we've got another one. Do you have any techniques for proning patients when you only have one pillow and slide sheets and don't have any other equipment available?
One pillow and slide sheets. The only thing that you would be looking at there, did you say no other people available? How many?
No other equipment. No other equipment.
Yeah, what you're going to be looking at then is possibly going back to the original technique of what we call the Cornish pasty. So you'd have one pillow across the chest. You would need to cocoon that pillow with another bed sheet. So you'd have the slide sheet underneath the bottom sheet. You'd wrap the patient up, literally looking like a Cornish pasty, and that's exactly how it looks. And then you'd need at least 6 members of staff around to bring the patient up onto their side and prone them over onto their front. You just need to be aware that if you've only got one pillow in situ, you're actually leaving the hips quite vulnerable, and there is a chance that you can get pressure sore from the hips if they're laying on a surface for a period of time and the patient's not moving. If they're on a proning mattress, you could deflate some of the cells. Proning mattresses are excellent for deflating cells, head, hip, chest, and so on.
Excellent, thank you. So why did you insert the slide sheet and the repo sheet using the roll down, but then rolled the patient to apply the bed sheet?
It was a time factor when we were doing the video itself. You can actually put the whole lot in. So if we're looking at the whole process, to be fair, you're 9 times out of 10, your patient is going to be on that bed. So my recommendation would always be that if you are in an area where you're regularly proning, I would prepare the bed itself. And by doing that, I would have the Versal slide sheet or slide sheets at the top of the bed and clipped to the bed itself with the repo sheet clipped with them. So they're folded in exactly the same way. And as you could see from the video, when we unfolded underneath the patient, if you bring the slide sheets down first and then you bring the repo sheet down, you don't really need to roll the patient, because there are times you aren't going to be able to roll them. So that technique would also work. We just run out of time of putting that one in, but it is something, again, maybe the next conference we can go through that and break it down a bit more for you.